Police in London say they spend 40% of their time dealing with people with mental health problems. But despite several deaths in custody, until recently there was very little support inside. The Met says that has now changed, and their top man, Sir Bernard Hogan-Howe, today showed one of their key critics round an improved custody suite. So did he see his recommendations in action? Here's Ria Chatterjee.
There have long been question marks over police attitudes towards mental health. An independent report highlighted discriminatory attitudes, officers handling people with too much force, making misjudgments and errors. A year on from those findings, and steps are being taken to improve the process of arrest for those with mental health needs. Custody centres now have in-house medical teams.
If someone's extremely unwell, acutely ill, I can arrange for diversion to acute psychiatric services.
So you are mental health?
Yes.
Tell me about your role.
NHS staff and police officers now work together to assess individuals. The report also called for a safer way to restrain people and a better system for storing case information. Sean Rigg had schizophrenia. He died at Brixton Police Station in 2008 after being restrained following an attack on a man in Balham. His sister thinks frontline training is crucial.
What is vital is that police officers need to recognise from an instant that this person may have mental health issues and to recognise the signs. And this needs to be at ground level so that the police station can be bypassed and they get the vital help that they need. They are not criminals, they are vulnerable people.
Today, the police commissioner praised the progress made so far.
Is this too little too late, do you think, for the families who have lost loved ones?
No, I don't think that's fair. I think, obviously there have been some terrible events in the past, often when, circumstances have been beyond people's control. But I mean, what would we do otherwise? Would the alternative be that we ignored that and therefore made no changes? What we've done is we've acknowledged there's been a problem. We've asked someone independent to have a look at it, to make some recommendations, and we've acted on them.
Of course it's too little too late. If you've lost a loved one, this is not enough. That's the bottom line. This is not enough. But what came across when we talked to those families and was really touching to me is that they don't want it to happen to anyone else.
It's the reason Marcia Riggs continues to campaign for her brother. She supports the changes, but believes it's all taken too long. Ria Chatterjee, ITV News.
A man from London